Namaskar. Good evening, everyone. Can you hear me? Am I audible? So, dear friend, in the previous class, we were discussing the different types of the guasa, about the different types of the guasa. And today we will see that how to do the practical, how to do the treatment using the guasa. So, guasa is the technique really very easy to treat because when we are inserting the needle, many times patients are scared. But when we do the guasa, it's a so simple technique. Even we can give this gua sha therapy to the kids. Sometimes we get scared if we see the red color. We are doing the gua sha and there is a red rashes are coming. But remember one thing. The color of the rashes is also telling the story of the disease. Like when we are doing the scraping. Some patients are getting the red color rashes. Some patients are not getting too much rashes. Some patients are getting purple color rashes. So even we can see the very little different colors, the combinations and the mixed form. So each and everything is explaining about the internal conditions. It's a very easy. So just like every day we are doing the combing, in the same way we are doing the guasa. This is a comb guasa. It's like the in the shape of comb. It's the comb guasa. So we can do from here. We can do from here. We can do from here and we can do from here. This is a comb guasa. This is a pen guasa, and we can do at many areas from this side and even from this side. And this is a very commonly used guasa. We can use for all the treatment. If we want to give the deep pressure, deep myofascial release, then we are using this Chinese scoop. And in the emergency condition, if you're not having anything, then I told you, you can use our desi spoon. You can use the wooden guasa. Okay. So there are two things which is really very easy to do. Number one, moxibation, which is not creating any pain. So we are igniting the moxa and giving on the points. And number two, guasa. These two things are really very easy to do, and we can do even to the kids. So today we will see the practicals. So I was thinking that whether to do the practicals for the cardiac problem or the lung problem or for the flu or for the female menstrual pain, or there are lots of disease as per our list. Then I decided to do the practicals for fever and common cold, because fever and common cold in the last 2 years, it's troubling a lot. It's giving too much trouble to the person. Okay. So let's see how can we do the guasa therapy for the person suffering with the common cold and fever. And if you are having someone in your home or nearby, do guasa today and just see the effect in 12 hours. So this is my request. Just do the guasa after this training of today and see the results. And sometimes you might feel, oh, how to remember this much points, because there might be 12, 13 points. Then don't worry. This is the sequence. You can see the sequence in the video, or as well as you can see the sequence in the PDF, step by step sequence. There is a no sequence. Even you can do the first point, then the third point, then the fifth one. There is a no such sequence, but these are the points we have to do now. So okay. So before doing the guasa, let's discuss one very wonderful imagination system on our anterior hairline. So let's see this. Because there are lots of imagination system we have to discuss. So Every day we will learn at least one imagination system. So let's see. Like here we can say on the anterior hairline, there is some person is lying down. So whenever anyone is suffering with any infections of the bacteria or virus, we always focus on the hairline, because bacteria and virus is entering from the hairline, whether the anterior hairline or the posterior hairline. This is the most common preferable place for the taking the entry by the bacteria and virus. Suppose there is a flu virus, there is a lots of other virus. If they want to enter in the body, definitely you will see, oh, the virus is entering through the respiratory path. But if we talk about as per the energy system, so there are many points on the hairline, they become sensitive, whether the anterior hairline or the posterior hairline, when there is any types of the invasion. So let's see this imagination. This is the imagination of the scalp therapy. As per the scalp therapy or the scalp acupressure or the scalp acupuncture, on the interior hairline, we are having complete body. We can see one person is lying here. This is the head region. Then we can see the chest. Then we can see the genital part, and we can see the legs and all. So how we can find out exact location? It's a very big questions. Okay. So today I will tell you how to find out. Now you can see in the second image, this is the image giving the clear idea, but how to find out? So it's a very easy to find out. First, you have to look at your eyes and see the black part of your eyes. So this is the black part of the eyes, which is called pupil of the eyes. Sorry, which is called pupil of the eyes. The pupil of the eyes means the dark black central part of the eye. That is the pupil of eye. So from the pupil of eye, if you draw the straight line, so you're reaching on the point on the hairline, right? So you're reaching on the point hairline. Now what we have to do? You have to draw the line 2 centimeter down and the 2 centimeter up. So from this line, you have to draw the line 2 centimeter up and the 2 centimeter down. So this line, which is exactly in the line of pupil, or we are telling in the mid pupillary line, this line is called abdominal line. Abdominal line. So the meaning of abdominal line, suppose someone is suffering with the gas, acidity and indigestion, you have to treat this. Someone is telling you, can you treat my liver? Can you treat my pancreas? My digestion is not good. There is some problem, some disharmony in my stomach. You have to treat this line. And this line is really very wonderful. And I have seen very wonderful results. The patient is telling, can you treat my constipation? Yes, why not? Then we are stimulating this line. And most of the time, when the person is suffering with a fatty liver, and there are many different types of the liver disorder, we are treating this line. And it's very easy to find out just from the mid pupillary line, draw the line vertically and find out this. So from the mid pupillary line, so this is the mid pupillary line, you can see the dark black part of the eyes, pupil. So here reaching. Now the question comes, doctor, I don't have hair. How to find out hairline? If you're not having hair, like suppose if we are not having hair, how to find out hairline? So we are considering from the eyebrows, if you go forefinger up, that is the starting of hairline. Okay, so we can imagine the hairline here. So this is the measurement. Our forehead is having this much width. So from here, if we are reaching here, now this is the place where if we do the gua sha here, if we do the gua sha here, we can work on all the digestive disorder, right? So this is the wonderful area. But right now our focus is not the digestive disorder. Right now our focus is common cold, flu, and the fever. So how to do the treatment of the lungs? So let's see here. So now from here, Now, first, after drawing this line, this is called abdominal line, or it's written here stomach area. Okay. Now, this is the central line from the central, and this line, if you draw one line just in between, that is called the thoracic area. Got it? Again, now from this line, from the abdominal line and the midline, if you draw the line just in between, that is called thoracic area. Again, we have to draw 2 centimeters up and the 2 centimeters down, and we have to do the guasa here. And when we do the guasha here, it's giving wonderful results, right? So we can treat the thoracic region from this line. So let's see how to do. So right now I am doing the demonstration of all the points one by one, and in the last we will unite all the points and we'll do the treatment all together. Then you can see the immediate result, instant result. As soon as your treatment will finish, the person will start breathing. The breathing will open. If the person is having blocked nose, you will see there is an opening of the nose just after finishing all the points. So this is the starting of the treatment, and this is the point number 1. So we are choosing any guasa. So let's see this comb guasha. Okay, we are going to the near the hair. So we are using the comb guasa. Now, before doing the guasa, I told you we can take castor oil, or we even can take coconut oil, or we can take guasha oil, guasha herbal oil. So any herbal oil is available. So let's do the practical demonstration. We will discuss everything one by one. Okay. So now let's see this. Our model is ready. So why I'm choosing, because model was roaming in the rainy water. So I don't want that he should get ill. Okay. So better to do this formula for him. Okay. So first we are applying this guasa oil. So we are measuring from the mid papillary line, we are going here. This is the stomach line. Now from the center line, this is the midline. In between these 2 points, if we are coming here, that is the thoracic area. So from here we go 2 centimeters up and 2 centimeters down. This whole area is called thoracic area. So we are putting few drops of herbal oil of the guasa. Now we will start doing the treatment from this pointed part, right? Okay. You can see I am doing the downward movement. So from the center line, I'm not doing the treatment on the center line. I'm keeping my thumb on the center line. So I am doing the treatment on the side of the center line. You can see here, whether it's visible or not. It's visible now. So I will do here, and after doing for certain time, there will be formation of the red races or the redness. That's the normal condition. So when we do, we are doing for near about 1 minute. So you can see here, if I touch this part become little hot. So I am doing very gentle scrubbing, gentle scraping. I can tell very gentle scraping. This is a very good treatment for the lungs, for the heart, because where I'm doing the treatment, that is thoracic area. Even we will stimulate certain points for the fever. So after doing the stimulation on certain points, I will do the stimulation on the fever points. So now we can see there is a redness has arrived. Okay, I will bring little closer. Now doing the same treatment on the other side. So we have to stimulate the thoracic area of other side. So applying the few drops of oil on the other side. In the Ayurveda, we are using many oils for this purpose, like the Panchaguna oil, and they are the very good for lungs and the common cold. So now we are, so there's a central line and there's a mid pupillary line, and in between there's a thoracic area, right? So we are doing the stimulation on the thoracic area. So 2 centimeter up and the 2 centimeter down from the hairline. So when we are holding the guasa, we are holding the guasa not like that, not with the 90 degree. We are holding the guasa with 45-degree angle. So 30 degree angle or the 45-degree angle. Then we just do the wrist movement. See, we just do the wrist movement. Okay, only wrist movement. So we'll do for 1 minute. The same treatment you can apply to any patients. In the home, you don't having anything, you're having comb in your home, then do the treatment with the comb. Okay, because everyone having comb in the home. So you can do the treatment with the comb if you're not having gua sha. Okay, so we have stimulated this area. Now this was the first area. We have done treatment on both the points for near about 1 to 2 minutes. Now after that, we will proceed to the point number 2. Now, so first I will tell you the location of point number 2, then we'll proceed. Actually, there is a no, there is a no, because why we are doing the downward movements, there is a no any directional effect. Okay, just we are doing downward. There is a, so when we are putting, because we are having habit to do that. Suppose in the acupuncture, some person putting the needle here. So one person can put the needle here like that. Another person can put the needle like that. So which is good? Tell me which is good. This is good. Why? Because practically I've seen if the person is putting needle like this and the person is sitting like that, someone is going from the front, and I have seen in the camps, someone is going from the front and suddenly like getting startled. If we are doing like this, so we are having habit to do this, but there is a no such effect of the direction. You can do in any direction. There is a no such effect of the direction. There is a no pain. Our purpose is not creating the pain. Our purpose is doing the repetitions of the scraping. Okay. So this is done. So we have done the scraping here. This is the central line. And this is the mid-pupillary line or the stomach. So we have done the guasa on this stomach area, in the stomach area, sorry, thoracic area, with the purpose to treat the common cold and flu. So suppose in this season, if you are having some common cold and flu, just do this. It's very simple. Okay. So now the step number 1 completed. Now we are moving to the step number 2, and step number 2 is very much effective. You know what is this? There is an international rehabilitation center to treat the very acute and the chronic problem, which includes pain as well as paralysis. So you might heard the name of Dr. Ju. Dr. Ju has given this image. As per the Dr. Ju, from the, if this is the top of the head, this is the top of the head. Okay. So how do you know where is the top of the head? So from the hairline, if you go 7 finger back, we can consider that is the area of top of the head as per the our this acupuncture science. So this point has been considered as a DU20, and the person who is practicing acupuncture regularly, they know 7 finger means 5 chun. So first I would like to tell you that how to measure the top of the head, which is very important task. So look at here from the hairline. Now keep the 4 finger, then the 3 finger. So where the 7 finger getting completed after that, this is the point which can be considered as the top of the head. Okay, we can tell it Sahasrara chakra having 1000 petals. We can tell the top of the head as per the acupuncture DU20. The great point, who is the control of whole body, the DU20. So if we want to go very simply, it's the 7 finger back from the anterior hairline. Now, so now this is the top of the head, right? So from the top of the head till the hairline, as per the Dr. Ju, we can treat whole body. We can treat the paralysis. We can treat the stroke. So in the part 2 of this Guasha course, we will discuss that how to treat obesity, how to treat stroke using the Guasa successfully and create the results from the day 1 in the stroke patients. If the stroke patient coming very early, we can create the result from the day 1. But if it's coming after many years, then result will be slow. So from here till the here, now we will divide this whole part in the equal zones. So let's see the other image for the clear understanding. Dr. Ju, ZHU, Dr. Ju. So let's see here. So from the hairline, we can do the whole body imagination till the top of the head. Now, for clear understanding, look at this image. Now, this part has been divided from the hairline till the top of the head. We can divide in equal 4 parts. Equal 4 parts. Zone 1, Zone 2, Zone 3, and the Zone 4. Zone 1 means we can consider as a head and brain area, head and neck area. Zone 2 we can consider as a chest area. Zone 3 we can consider as a abdominal area. And zone 4 can be considered as a genital area or the lower abdominal area. And this imagination is really very wonderful. Okay, right now our focus is chest. So now we have to do the guasa here, and when we do the guasa in the chest, person even getting the strength in the arms, because from the chest, from the thoracic area only, our arms are taking exit. So the next image will be this. This is called the zone 2 or the chest area, and we are using this area with the purpose to treat heart and the lungs problem. Okay, so from the central line, if we go, we can make the belt from the central line. We can go 2 centimeter this side and 2 centimeter this side. This whole area we can treat for the treatment purpose of the lungs as well as the heart. So let's come back here and do the practical demonstration for this part, because each and every part is very important. And the gua sha has adopted this imagination of the scalp, right? So why I'm telling this? Because as per the international standard, these images has been taken by the gua sha organizations. Why? Okay. So because there are lots of images, but whatever has been taken by the International Gua Sha Association, we are discussing that images only. Fine. So let's see the image number 2. So we are taking the gua sha, any gua sha. So right now I'm choosing this. Again, you can choose any other gua sha. And I'm also choosing the pen gua sha, right? So from the anterior hairline, if I measure 7 finger, 4 finger, then the 3 finger. So this whole area is doing the representation of complete body. This whole area is doing the representation of whole body from here to here. This 7 finger area. Okay. Now, if the 7 finger area be divided into 4 parts, near about 2 finger. Okay. So just leave the 2 finger, then this can be considered the chest area. The central area can be considered as the chest area, right? So we'll put the few drops of the gua sha here. Now, we will spray it with the comb gua sha. The comb gua sha having the comb shape, if we want to use in the hairline area, in the area of the hair. Like, see, if I'm doing the comb gua sha, we can see the part of the scalp is exposing here, right? Now I will do from this rounded part. So I am keeping my hands. Now we'll do only wrist movement. So first I will touch this area and tilt my gua sha with the 30° or the 45°. Now just we'll do the hand wrist movement. So when we do this movement, we are focusing on, suppose we want to dissolve some nodule here. We want to melt some nodule. So there is a formation of the nodule on the corresponding area. When the person is suffering with the lung disorder, there is a formation of the nodule here. So there's a wonderful treatment we are keep on doing. And this treatment is very relaxing, not at all painful. There is no question of pain. Instead of pain, this treatment is very relaxing. The person is enjoying. कैसा लग रहा है? So how are you feeling? Good. He is feeling good. He is feeling relaxed. दर्द हो रहा है क्या? He is telling no pain. I am giving good amount of pressure, but still he is having no pain. You can see the angle of Gauss is the 45 degree. And you can see the movement of wrist. I'm not doing like this. I'm not doing like this, right? I am just doing the movement of wrist. So this was second imagination. Now this is the pen. We want to disperse the energy. We just move the pen like that on the area. So there are two types of the energy pattern. One, we want to disperse the energy. Second, we want to bring the energy. So we will discuss this thing, that how to disperse the energy and how to collect the energy. Right now I'm dispersing the energy from the area. So this was the second imagination, and the wonderful imagination to improve the lung, to improve the heart. And we know when we are improving the heart, definitely the person will be feeling very good and calmness in the brain and even the mind, because heart is the seat of mind, heart is the seat of brain. So after doing the second imagination, these each and every imagination are like the treasures, because each and every imagination is not only treating one condition like the chest, but they are treating head, chest, abdomen, and the reproductive part, because John 1 is for the head region, John 2 is for the chest region, John 3 is for the reproductive part, and John 4 is the genital part, right? In this way, these zones are the treasures, right? 1, 2, 3, and the 4, right? So let's go ahead and see the imagination number 3. So for the lungs treatment, you have to be, because see, if you want to heal some, definitely you have to do the certain amount of treatment. If someone is suffering with a common cold and fever and you don't want to go to the doctor, you have to do the certain amount of the treatment. So definitely, until unless you finish the treatment, we cannot avoid fever, cough and cold, blocked nose, and these all. So let's go and learn the third imagination now. As per the third imagination, the third eye is the place of the lungs. Third eye. Okay, we will discuss these all the areas. Okay, so we can see on the face, on the alag in the different area, we are having different points. But right now, we talk about the third eye. Third eye is the place of lungs. Okay, so we can consider the effectiveness of this is too high. When anyone is coming to me, doctor, can you treat my lungs? Can you treat my asthma? Can you treat my cough and cold? We are igniting this moxa like we are igniting the cigarette. So you can consider this moxa like the cigarette. But there's a one herb, Chinese herbs. Okay. So that is Artemisia vulgaris. The botanical name of that herb is Artemisia vulgaris. So that herb is inside, and that herb is having some medicinal quality. So we are igniting here like the cigarette, and we are doing the stimulation on this point from the distance. We are not touching it, from the distance, from minimum 1 inch distance or the 1.5 inch distance. So suppose we want to do the MOX heat treatment here. So we are keeping minimum this distance, and we are just rotating the excellent treatment for lungs and asthma. I have tried 100 times for my many of the patients. If you know, then we'll go proceed. If you don't know, then I will do the demonstration, because the single treatment is enough to cure lung disease for many patients. When the kids suffering with the cough and cold, we do moxibustion for 2 minutes and cough and cold over. When the kids are having, and not only kids, adults and everyone having some problem, we use this. Only we cannot use this if the person is having allergy with the fume, because there is some fume is coming out when we are igniting this. Okay, we can do for anyone. There is no any contraindication with that. We can do this even for the person suffering with the high blood pressure. Okay, I will do the quick because it will take hardly 2 minutes. So let me ignite this. So we are igniting with the matchstick or with the candle or with our kitchen rasoi gas. So we are igniting it, right? And after ignition, like the cigarette, then we are stimulating the third eye. So this is the method number one, because ultimately this point is belong to the lung. Or the second things, we can do the moxibustion here. So the number one, we can do the treatment. Second, we can do the moxibustion. I will demonstrate both. So suppose if I want to do the moxibustion here, because this is very sensitive part, we can't rub anything too much here. Remember, don't rub anything too much here. This is a very highly sensitive point. This point is the has been told Agya Chakra. Agya Chakra, and this point is having too much fire, too much heat. So when we do the moxibustion, we are not touching this point, we are doing the moxibustion from the distance. But if you were rubbing something, then don't rub too much. So suppose I am applying the oil on the third eye, right? Because I want to stimulate my lung point, because season is changing. So see, I am taking this spoon guasa, and now I can you can see I'm using the curve of this spoon. So if we are stimulating 30 to 35 times, that's enough. Enough. Done. Or we can do the moxibustion like this. So this is the moxa stick. I have ignited this like the cigarette. You can see. Now the stimulation of the points with the moxa. I can feel the heat. I have to keep it at the distance where I can feel the heat. And there's a great stimulation of this lung point or the third eye point. And we can do this even prior to meditation. If we are doing this prior to meditation, as soon as we do it for only 30 seconds, we will go in the deeper level of the meditative state. You can try this. This stick is easy, hardly available in 20-30 rupees, and but it's magical. Okay, I will demonstrate to the model how to do both the therapy. Moxa, see, there are two things. Number one, if we are using some equipment like the spoon or the moxa, or we are using our finger is having more energies. Okay, finger is having very high energies. Yeah, we can do the moxibustion for the patient suffering with the cough and cold, even having high blood pressure. As per my own experience, when I'm doing this moxibustion, only few person are not feeling good. The person having high pitta, we are telling pitta personality. Pitta personality having too much heat in the body. Okay, we are not able to do the moxibustion for them. They feel not comfortable. Okay, but the same person, when they are having cough and cold, that time they are comfortable. So let's see now how to do it. So first I will demonstrate you and today onwards, when someone is suffering with a cough, just try third eye point for few person and give me feedback. All of you might be having my number. Give me feedback. I'm sure that you will be telling me that this is a wonderful point. The single point, this is a wonderful point for cough and cold. Now, we can take any guasha. So let's change the guasha. Okay, so we are taking this guasha now. so that you can understand that we can use the different type of basa. So we are pulling the third eye upper, like when we are putting the tilak, we always put the tilak in the upper direction. So we are pulling the energy in the upper direction. So in the same way, we are pulling this in the upper direction. Don't do more than 30-40 times, because this is a very sensitive point. So we are holding here. See, only I have done this much and the area became red. You can see the area became red. This is a very sensitive. Even if someone is having, there are two types of people. Some person having some people are very fair. You can see the redness appear very fast. If the person is having more melanin, then you will not able to see the, okay, done. But even you can see the redness here. Whether we are able to see the redness or not, anyone can see. Now I will show that how to do moksha. So great treatment for cough and cold and the lung problem. Let's see this. So we are keeping near about 1 inch distance, and from this distance we are doing moxibustion here. So just we are doing little just we are doing clockwise movement. As per, there are many pranic healer coming to me just to buy this moxa stick. Then I'm asking why you do this moxa. So they are telling, if we do prior to meditation, we feel awesome. So even you can try. This is the very wonderful activation of the third eye. Just we are rotating the stick clockwise. You can see like that. And we are telling the person that if you feel too much heat, tell like whom. So if the person is telling whom, then we can keep it away. So the suppose person is telling whom, then we will keep it away. Then we'll bring back again after some time. Maintain the distance. So this is the stimulation. 30 seconds to 1 minute is enough on this point. So this point is very effective. Self karo. So even we can do for ourselves. Suppose if you are having some cough and cold, you can do for yourself, right? Done. Wonderful. So this was the another point. Whenever anyone asking me on the phone call, can you tell me some points? I'm suffering with the cough and cold. Then I'm suggesting yes, you can do the moxibustion on third eye, because everyone knows where is the third eye point. It's very easy to do. Even we can send them image, and this moxa stick is available throughout everywhere, in every part of the India. And like suppose we have finished, but moxa stick, we have in one treatment we are using only this much moxa stick. Then we are putting in the salt. So there will like there is no fire after that. So we are after that we can preserve it, and again we can do in the next treatment. We can use it for the next treatment. So one moxa stick we can use for many days till it's not finishing, right? So one moxa stick can be used for many days, for longer time, right? So in this way, we have discussed just the few points. हमने केवल कुछ पॉइंट का डिस्कशन किया. We have discussed only few points. You try. Still, we have discussed only 3 points so far, but there is total 10 to 11 points. And as soon as you do the treatment, the 10 to 11 points, there's 100% sure there will not be common cold and the fever, but the time is over. By considering the time, now we'll do the discussion of the same class on the Wednesday. Okay. So now from the Wednesday onwards, class will be only for the enrolled participants, because people were asking me what is guasa, what is guasa. We have not heard about the guasa. So we have done this free class for 2 days so that you can understand what is guasa. Now in the upcoming 22 days class, we are going to discuss a lot as per the list given by me to all of you. So many persons were asking me whether it's painful. So now you understood it's not painful. Whether it's very difficult, can we do? Yes, you can do. Whether it's more difficult than the acupuncture? No. You cannot consider, you cannot think how much this is easy. Whether we can create the results like the acupuncturist creating, sometimes you can create more results. So do not underestimate the power of Guasa. Internationally and even in the China, this therapy is highly like many persons have opened their clinic, and the name of their clinic is TCM Guasa Clinic. They are just doing Guasa for anything. You are telling runny nose Guasa, back pain Guasa, knee pain Guasa, fever Guasa, asthma Guasa, for everything they are doing Guasa. So Guasa is very easy and very wonderful treatment. So enough for today. So the participant who has enrolled, we will provide the recording to all of them for 1 year. Okay, so if anyone wants to enroll, can message me or can message Natasha ji. Okay, so thank you so much. Closing the session now. This therapy, see, Guasa itself is a very big, okay, very big. We can't combine this and that, but Guasa is also the TCM. Guasa is also the TCM. If I'm telling you that we will learn Guasa, it means that we will learn TCM, means traditional Chinese medicine. Okay, but we cannot learn the whole TCM. The whole TCM will take long time. Okay, but we will learn the whole Guasa as per the syllabus, and we will able to treat the disease as per the syllabus given by me. And I have covered all the common disease, and the most common disease are stroke, overweight, your beauty, lungs problem, heart problem, menstrual periods problem, and the lots of problems, liver disorders, digestive disorder, what else you want. So all the common problem, all the patients having common problem coming to our clinic, we have already covered. Okay, so this is a 22 days program, 15 days level 1 and the 7 days level 2. Okay, it's a 22 days program.
Namaskar sir.
Namaskar.
Thank you for this opportunity. ये बड़ा सिंपल हो गया सर, क्योंकि कभी कभी होता है कि सिचुएशन नहीं होती है, हमारे पास मैग्नेट्स भी नहीं होते, कुछ नहीं होते, ये अच्छा है। इसको कंघी रख लो।
चाइना में ऐसे ही करते हैं। पहले एक्यूपंक्चर कैसे करते थे? पहले कुछ नहीं होता था तो कांटे तोड़ के लगा देते थे, कांटे, है ना। और आयुर्वेद में तो एक्यूपंक्चर दिया ही है। आयुर्वेद में सूची भेदन कहते हैं, सूची भेदन एक्यूपंक्चर दिया है। तो सब कुछ बहुत आसान है, लेकिन अब जब बस हम कोई भी चीज हाथ में आ जाए बस हम उससे ट्रीटमेंट कर सकते हैं ना।
That's a very beautiful thing.
Because see, I always prefer this spoon. This is my favorite spoon for the bath.
सर ये तो बस, ये तो कमाल है।
कमाल है। ये तो इसलिए क्या होता है कि कभी पेशेंट को इससे ज्यादा करेंगे तो पेशेंट बोलेगा डॉक्टर साहब ये तो मैं घर पे कर लूंगा, तो फिर ये करना पड़ता है। ये तो घर पे नहीं कर पाओगे ना, ये तो हम ही करेंगे ना।
तो सर प्लास्टिक का ले कि क्वार्ट्ज के भी आते हैं सर, कौन सा बेस्ट है?
कोई भी लो आपका, सब क्वार्ट्ज का लो, आप प्लास्टिक का लो, स्टोन का लो, सब वर्क करते हैं।
सब सेम है?
हाँ, सब में सब वर्क करते हैं, बट कोशिश करो कि वो इलेक्ट्रिक का कंडक्शन मतलब कंडक्टिव नहीं होना चाहिए। यानी वो जैसे मेटल, अब स्पून तो कर लेते हैं हम, कोई प्रॉब्लम नहीं, स्पून तो बहुत अच्छा काम करती है, लेकिन अगर इलेक्ट्रिक कंडक्टर ना हो तो इट्स गुड। ये ग्वासा के लिटरेचर में इट्स गिवन दैट इट शुड नॉट बी इलेक्ट्रिक कंडक्टर, बट वी आर यूजिंग स्पून एंड वी आर आल्सो गेटिंग द सेम रिजल्ट्स।
सर वुडन भी आ रहे हैं, तो वुडन में तो वॉश करने में दिक्कत हो जाएगी ऑयल के साथ।
वुडन मेरे पास है, लेकिन इवन आई डोंट प्रेफर द वुडन, क्योंकि वुडन क्या रहता है ना, वुडन ऑयल को एब्जॉर्ब कर लेता है ना। सो बेस्ट होता है कि आप है ना ये स्टोन का यूज कर लो या फिर प्लास्टिक का यूज कर लो, है ना, तो उसको बाद में आप आराम से धो सकते हो। you can wash it
Right.
very properly without any difficulty.
राइट सर, राइट सर। अभी ये नर्व्स प्रॉब्लम बहुत हो रही है, बहुतों को वेरिकोज वेन्स हो रहे हैं सर,
हाँ हाँ,
उसके लिए कुछ कर सकते हैं
वेरिकोज
सर
वेन्स
इसमें?
हमारे सिलेबस में है, हमने दिया है.
ओके,
Because see, every time people are asking the question about the varicose veins whenever we are doing any class. So I have given varicose vein automatically because we know someone or the other will ask the question of varicose veins. So I have given previously. You can see the syllabus, it's already there.
सर नेक्स्ट क्लास में वेरिकोज वेन्स ले लेंगे सर प्लीज। क्योंकि मेरे 3-4 लोग हैं जिनको ये प्रॉब्लम है एंड एवरीबॉडी इज
हाँ,
सफरिंग।
वेरिकोज वेन्स ले सकते हैं, कोई प्रॉब्लम नहीं है. पहले ये कॉमन कोल्ड खत्म कर लेंगे और फिर हम ले सकते हैं इसको, कोई प्रॉब्लम नहीं. कोई भी आगे पीछे ले सकते हैं, वो अपनी वे से, नो प्रॉब्लम.
सर थैंक यू वेरी मच सर।
So thank you so much everyone. Closing the session now.